welcome back. This is our last session. Sorry. This is our last session in our showcase. And, you know, it's been so exciting to hear this rapid fire 2x2 scientist stakeholder partnerships. And now the focus is on the theme of improving decision-making tools. Our first two speakers are Jane Gilbert from the Miami-Dade County and HAQAST member Chris Uejio from the University of Florida. So here you go, Jane. Thank you.
Thank you. It's great to be here. Thank you, Chris, for inviting me. So I was appointed 4 years ago by Miami-Dade County to address the increasing health and economic impacts of extreme heat in our region. So we're going to talk a little bit, and I'm really going to turn it over to Chris shortly to share how he helped us with our heat vulnerability analysis, in part using the NASA tools, and then how we engage stakeholders, and then how some of that, both the data and the stakeholder input, informed our implementation plan and our progress on that plan. It's all going to be super quick. So with that, I'm going to turn it over to Chris from Florida State University.
Thanks, Jane. Hi, folks. It really has been a pleasure. Certainly working with HAQAST, being really a fly on the wall and being able to learn a lot. And then equally, really a treat and an honor to work with Jane Gilbert. As I know I say it many times, but I've been working on extreme heat for a long time, and maybe we've created tools, and oftentimes in anticipation that someone would use them. And maybe sometimes in the best cases, they would use them for visualization or communication, but they wouldn't actually use them for decision making. And it's really been really a treat and a privilege to work with Jane and her team, who are actually not just using them, but they want the information yesterday to make actionable decisions. So just a bit just on the NASA side. So our work is really focused on better characterizing the urban heat island, or essentially how much hotter are the urban core compared to sort of surrounding rural or exurban area. And then here from some of the other satellites, or some of the other remotely sensed observations that weren't as well referenced, the one that we rely on is EcoStress, which rides along the International Space Stations, commissioned until 2029. And of course, we're going to combine that with some other information as well. Thank you. Some of your usual players that others have used, but essentially to come up with gathering information on exposure in places where we just don't have observations. So extreme heat is a bit different than air pollution, but in some ways the story is the same. We're going to use a very similar workflow. We're going to need combined satellite or remote Earth observations to fill in the gaps of our knowledge, and we're going to splice that with state-of-the-art or in some ways creative, emerging ground-based networks as well. So this is just an example. We don't have enough time to characterize some of the other places we worked at. We work in Orlando and New Mexico and Wisconsin as well, thanks to the HAQAST grant. But we preferred to go deeper into one of our favorite case studies here. But this is just an example. These are private weather stations. So in a city of any size, you might have 200 or 300 private weather stations that pass quality assurance and control tests. So that plus our NASA Earth observations really give us a better characterization. In this case, this is sort of a diurnally resolved, or over an average 24-hour period. How does that heat exposure change? And we can do that with accuracies that are at or better than what's in the published literature. So Jane's team asked us two questions, really. The one we'll just talk about just very, very briefly. What are the characteristics of the places that suffer disproportionately from extreme heat-related illnesses? So here we ended up looking separately at hospitalizations versus emergency department visits for those of you outside the health field. broadly, hospitalizations are going to capture those as heat-related problems in older adults versus emergency department visits, anywhere from like your teenagers to your working age, occupational-related, heat-related illnesses in general, right? And there's obviously overlap between these two. But what we found, just using some spatial statistics, is that broadly for hospitalizations, those older adults, again, just being poorer was the most important factor for having higher rates of heat-related illness versus the emergency department visits was more of a complex, both heat exposure story plus socioeconomic vulnerability story. So there's some occupational risks there, there's some demographic risk as well. So with that, I'll turn it back to Jane.
Awesome. So Chris was able to then create a heat vulnerability map with the darkest red areas being our highest vulnerability areas. The way that's it's different than other heat vulnerability is he started with the health data, with the emergency department visits and hospitalizations. And the disparities are quite significant. So those deeper red areas were experiencing heat-related emergency department visits and hospitalizations roughly around 4 times the rates of in zip codes with the lighter yellow. So big difference. And, oh, wrong way. Just so you know, we work within an office. There's people working on sea level rise and increasing flood risk, people working on reducing greenhouse gas emissions, on water quality, and we look for solutions that integrate all. I put together a task force in addition to the study to really better understand who and where people are at risk. There were 15 members. We had the state health department, the National Weather Service, our university partners, our community partners, people with lived experience. I co-chaired it with the woman in this photo who is a internal medicine doctor who's worked her life in vulnerable communities and been quite an advocate. Our Extreme Heat Action Plan is a collective action plan. So all of these players from the different that were involved in the planning are also involved in the implementation of that plan. We have 3 main goal areas: to inform, prepare, and protect people, to help people stay cool at home affordably and make sure with compound risks of power outages, we have enough backup power in critical facilities to keep people cool, and then to mitigate our urban heat islands. So with that heat vulnerability analysis, we were able to target our heat season campaign. Yes, we reached 2.8 million, which is roughly the population of Miami-Dade County through multiple impressions in multiple standards. But in those zip codes, we were able to say, okay, we want the billboard and the bus shelter ads and the bus wraps in these neighborhoods. We want the digital media at the gas stations and medical offices in these neighborhoods so that we know we're targeting the areas that need it the most. Similarly, with the heat safety training, we do that with community-based volunteers. We target recruitment in those neighborhoods. We also know where we need to focus our investments in helping people with their home improvement programs and making sure we install AC in all, or make sure all our people under the county's care have access to affordable cooling. So that's been very helpful. And in addition, we do a lot of outreach just on no and low cost things people can do. The last area that we've really used this information for targeting is our urban heat island mitigation. You saw the direct correlation between the land surface temperatures and our emergency department visits. So we doubled our funding for urban tree planting from $8,000 a year to $16,000 a year in the last 2 years. But 95% of those investments are in those areas with the highest heat vulnerability. We are also investing, prioritizing where we're putting up new bus shelters in those areas, et cetera. So it's really, I guess, the advantage is we have limited dollars, we have limited resources in government. By having this data and being able to target those investments, we're knowing that. And heat health data, Chris can be the first to say, it's very hard to get good data on who and where people are at risk. And so I'm really grateful that we were able to have this and be able to use our dollars most effectively. So thank you.
Great. Our next two speakers are Pawan Gupta from NASA Goddard and Stephanie Christel from the Department of State.
Thank you, Tracy. Okay, thank you, Tracy, and thank you, everyone. It has been 4 years. We have been working on the Department of State's on providing forecasting at U.S. Embassy locations and other posts all over the world. So we have Stephanie here. She is our partner from the State Department. So I will let her go first, and then we'll talk more on technical.
Great. Thank you so much, Pawan. Here we go. Let's see if it'll work for me. Okay, great. So at the State Department, we have a problem. We operate more than 260 embassy consulates all over the world in different cities, with many with high levels of air pollution. So as you can see, more than 3/4 of our diplomatic posts overseas have annual air pollution higher than the U.S. standard. And so this poses an issue, a problem for the tens of thousands of Foreign Service officers, locally employed staff, and their families that operate in these locations and that have obvious health impacts from this, whether you're bringing your young kids with you or your aging parents or other family members. The health impacts of these extraordinarily high levels of air pollution can be a real challenge. Moreover, we have the issue of not having real-time, reliable data accessible to these personnel, so they can make informed health decisions either about where they're going to go next, where they currently are, or even just living on a day-to-day basis. Should they go out for that run outside today? Should the Marines have their outdoor exercise? Do the kids have soccer practice? So there are a lot of implications from the health perspective and the morale perspective of our employees working overseas. And so several years ago, we came up with a solution to kind of close the gap in terms of having real-time air pollution data so that our personnel and their families could make real-time decisions about how to protect their health. And so this all culminated in the development of a program called DOS Air, where we now have in more than 80 locations reference grade, high quality air pollution monitors, primarily measuring PM 2.5, but we have about 15 ozone monitors as well. And that data is now published on an hourly basis, both on the EPA's Air Now website, so shout out to EPA, thank you guys for your support and partnership, but also on the departments, we have a mobile application called Zeph Air. We'll talk a little bit more about that in the future. So we now have data in these 80 locations, but this program, we still have some challenges because it is expensive. For any of you that know air quality monitoring equipment, it does not typically come cheap. And with budgets the way that we are, we're always looking to be more efficient, more lean, be able to get more data where we can at the lowest cost that we can. There is also a long lead time to get these monitors in place, about 6 to 12 months from actually having the order in hand to getting it sited and installed in situ and getting that data up and running. And then we also have the challenge of ongoing maintenance. Our personnel are already stretched thin and sometimes wear multiple hats. And so the maintenance that goes into making sure these monitors are kept up in real time can certainly be a challenge. And so this is where the conversation came in with our colleagues at NASA, Pawan and others, to try to close that gap as best we could. So Pawan, I'll hand it over to you.
Great, thanks, Stephanie. So with that in mind, about 4 years ago, we came with a HAQAST project with the objective to provide air quality forecast of selected U.S. missions or diplomatic posts all around the world. So to do that, we started with what is it already an operational Goddard Earth Observing System, or other words called GEOS Earth System model, which already assimilates all of the satellite data for both meteorology and aerosols. What you see here on the picture is providing different types of aerosol forecast, already providing for next 10 days, for every 3 hours. So that is what GEOS-FA, that became our base model. This is already available globally every day, but it is not fine-tuned to locations, and it is not providing the information which we want embassies to be used for air quality alerts or for forecasting purpose. So we combined that data with DOS air measurement, which Stephanie just explained, from all those 80 locations, and fused everything into a machine learning algorithm so it can provide you a localized, calibrated, or bias-corrected PM2.5 concentration. And we actually did that for next 3 days, 72-hour forecast. It is issued every day and bias-corrected, and that is provided through our system, which has been implemented in various applications, which you'll see next. Okay, so here is a quick example of how we are evaluating that. And so on this particular graph, what you see an example of forecast, which has been evaluated in real time. And this particular one is showing an example from Doha in Qatar. There was a dust storm, small dust storm, which actually had some air quality issues. So what you see, the black line is measurements, and the forecasts are in the colored line, different colored lines, issued every 3 days for, issued every day, but for 3 days, next 3 days. And you can see that wherever we have measurement, it matches. It's not exactly one-to-one match, but it is pretty good estimation of what air quality will be on those days. So we have done this evaluation for global location. We have a publication which is coming up for more technical details. So next, turn it to. Okay.
All right. And the result and our implementation in decision making. So one of the great things that also came out of this is that Pawan developed and team developed a 25-year historical look at air pollution for our more than 260 locations. And now that is being integrated. We at the department have a tiered system for each of our posts, where we kind of grade the relative level of air pollution as compared to the United States, so people can get a decent idea of how one post might compare to the other. So when they're trying to select where they're going to next, they have a good idea of what the air pollution might be in that location in a very generalized sense. So we're now using this historical data and integrating it into that system. As I mentioned earlier, we also have a mobile application. We both have a dashboard and a mobile application called Zeph Air. And so now you can see the forecast. This is a public-facing site and application. You can now get that forecast both in the kind of the 3-hour chunks and as well as the 3 daily forecasts in there as well. And what is really fabulous is that, again, this is for the 260 locations. We don't necessarily have to have a monitor at all of these locales. So you can get near real time, very reliable from NASA data to be able to hopefully integrate into your daily consideration about how this might impact your health. And really at the end of the day, this is all about our people. Oh, come on. Maybe? There we go. So this is just a quote from one of the personnel that when we released this back in June of last year, the impact that it's had on their family. And so we've really pushed out the forecast to all of our personnel to be able to make sure that they can use. But the benefit to putting it on here is our interagency colleagues can use this as well as the generalized public. So this is something that was really developed to support our personnel, State Department personnel, from a management perspective, but has a much broader impact than we had initially even intended it for. But as I mentioned, this is really all about our people and them being able to have that data to make important decisions about where they're going to next, how they're going to help protect their families and their health for the future. And so, Pawan, I'll have you wrap up.
Okay, so thanks, Stephanie. I think the last slide is basically, I just want to acknowledge all the people who have helped throughout this project. Definitely Stephanie, Dr. John, who was fellow at Department of State in the beginning, who actually started and brought this idea, and we started working. Mary, who is here in the audience, she has been continuously helping with us. And we have Dr. Sao here, Dr. Alkma Saeed, both worked on this project as a postdoc and developed this machine algorithm and provided forecast to make sure they are implemented in the Department of State's app. So we have API, and then the apps are available also on the store, the Zapier, which has the data. And I think finally I'd like to thank HAQAST, all the leadership of HAQAST, John, Tracy, Jenny, everyone, to support this project, get it started. And I think SNWG have been supporting this project to continue in future and expand it more on more locations. So I'd like to thank them also so that we can actually continue working on it, continue supporting Department of State and other agencies. So thank you.
Great. Our next two speakers are Jingqiu Mao at the University of Alaska Fairbanks and Mary Uhl, who's one of our HAQAST ambassadors, and she's with the Western States Air Resources Council. I don't know which of you is going to.
Thanks, Tracy. Thanks, John, and all leadership from HAQAST for this opportunity. I'm really grateful for this chance to be able to present you some work we have done at the University of Alaska Fairbanks. My group also, we do a bit of remote sensing on formaldehyde and other things, but today I'm going to focus on wildfire today. So when I first started my job in Alaska, my first summer, that was 2017, I was burning smoke for a month. I was shocked. I didn't know why that would happen because I never heard about wildfire in Alaska. And I was there for months, and I feel like I am an emergency scientist. I'm a modeler. I also do measurements. There's something I could do. So I called Tracy. Tracy, what can I do? Tracy said, well, HAQAST might be an opportunity I could start think about using satellite as a tool to understand Alaska. So I look at Alaska, it's huge. Does anyone know how big Alaska is? It's almost half of the size of contiguous U.S. I think it's much bigger than Texas. Texas is the second largest state. No offense to. And in terms of burning area of Alaska, if you look at the upper right, the burning area can be millions of acres every single year. It's huge. And yeah, not many people talk about that. One reason, of course, is not many people live in Alaska. Why do we care? Well, the argument is that I think a lot of you have been exposed to fire from Canada, right? Recent years, folks on the East Coast, folks in Wisconsin got exposed to wildfires. So what's happening in Arctic does not necessarily stay in Arctic. They often get transported to lower 48. That's what we call you guys, lower 48. And no offense there either. So lower 48, and this become a new normal because with the climate change, that there are a lot of research showing that extreme wildfires become more and more common in Arctic. Arctic is one of the regions we get more extreme fires. And yet, I look at the ground-based measurements. If you look at the lower left, there are about 5 regulatory monitors in Alaska, only 5. Think about the whole, someone should monitor, there are thousands of monitors in lower 48. We only got 5 regulatory monitors. We got 20, 30 purple airs, and there's 4 or 5 AirNet in recent years. They're very sparse measurements. What can I do? I feel like satellite is the only way I can rely on at that point. I decided to really work with, try to write my proposal well. Fortunately enough, I got funded, so I was able to get started on my Arctic wildfire work. So we first start as a model. We first try to use model relationship of AOD to PM2.5 relationship to derive surface PM2.5. This was done by my student Tian Zhao. We realized actually model really don't really do a very good job on wildfire transport because there are many reasons injection height. There's a numerical diffusion. There are many reasons for that. So this is something we have to face as a modeler. There are some challenges we have to face. So then we trying to go to other satellite sensors, MODIS, WIRS, and Calypso as well. We're trying to understand the vertical distribution. We soon realized that actually when you have stronger wildfire, the smoke can go up even to a higher altitude, and we're trying to use ground-based measurements, including purple air sensors, and together to come up with a relationship. That's something we really did not have much resource to work to start with. But this is also the case from many places. Many unmonitored areas, they are facing the same problem. They do not have much ground-based measurements, and yeah, they want to know surface-based PM2.5. For example, when I was in Alaska, I want to go hiking. The next day, I want to go camping with my daughter. I want to go fishing or go to check out glaciers. I don't want to go to somewhere with heavy smoke. That's just not smart. I don't want to bring my daughter to somewhere we have so much smoke. So I have to rely on air quality map, air quality forecast to tell me where to go. That's called decision making based on the day-to-day operation. And we need satellite data. We need use satellite data as a guidance to tell us where to how to plan our day-to-day activities in summer. So this is something we develop some relationship. We're able to use that relationship to derive some surface PM2.5, daily surface PM2.5. It's not necessarily complex enough. It's something we have to improve. But right now we are using this, trying to develop a stepwise relationship based on AOD to understand surface PM2.5. From there, we really can have some idea about surface daily PM2.5. That turns out to agree pretty well with measurements. Okay, so we are currently developing a roadmap for future applications. We are trying to combine all the satellite data and the ground-based sensors and local sensor together with a model. We're using HERS smoke model combined with machine learning. I feel lucky enough to be able to work with a lot of great scientists, Pawan, Gupta, and Jingqiu, and so on, so many great scientists. Together, we were able to develop some products. This is still in progress, but we are writing some papers about doing this air quality forecasting in Alaska for better accuracy. Okay. And one thing I want to mention is that we are also trying to work with stakeholders. And right now, we've been working with Alaska Wildfire Management. We've been working a lot with Bureau of Land Management and National Park Service, as well as Geographic Institute, we call GINA at Alaska, together to try to disseminate this information through this wildfire management website. This is it's been going well. We got a lot of good feedback, and people really use this information to guide their day-to-day operations. Okay, I have one last thing I want to give a shout about. Is this from my colleague Jingqiu at the University of Iowa. Their group developed something called NASA Fire Light Detection Algorithm. This really gives you some information about modified combustion efficiency, tell you where it's smoldering, where it's flaming. And this information turns out is extremely useful. For example, they are looking at this fire over LA, Los Angeles, for recent couple weeks ago. We all know LA fires, and you can tell where you have flaming, where you have smoldering. And more importantly, you can use that information to tell you where fire is gonna progress for next day. That's actually really, really important. Here, I'm gonna show you animation. You can see that, hopefully that will show up. You really can use that information to figure out where the fire is gonna spreading towards, and you can use that to help firefighters to plan accordingly. Okay, here's the animation. You can see that the blue ones are the fires are smoldering. The red ones are fire flaming. You can see when the fires are flaming, the next day it becomes smoldering and it continues to move on. So it seems to me this is a really extremely useful tool to help firefighters to figure out where to go for the fire fighting. I think this is really something we are hoping to put in our to use that in Alaska as well in the near future. With that, I will turn this to Mary.
All right. Thank you. Okay, let's see. So, does that get us to, no? Okay. This way? This way? One more? Oh, no, there I am. I think it is going. Okay. All right, I am Mary Ewell. I'm with Westar. We are a multi-jurisdictional organization for the Western United States, but that's not really descriptive of what we do for probably 99% of you in the room. We are actually a nonprofit council of the states, locals, and tribes in the Western U.S., focusing on air quality. So we provide a forum for state, local, and tribal air agencies in the West, as well as federal land managers, to come together and talk about air quality issues in common in the West. So this is the Westar region. We're 24% of the U.S. population, but 50% of the U.S. landmass, probably thanks to Alaska for that one. But we cover, I like to say it's kind of a diagonal. If you think about from Alaska down to New Mexico and from the Dakotas down to Hawaii, but skip that, that large country to the north, Canada. There's 93% of the federal lands in the U.S. are in the Westar region. That's a lot of federal land, a lot of federal activities that sometimes the states have jurisdiction over and sometimes they don't. There we go. Western air quality. These are some of the headlines over the years. Really huge focus in the Western states and local and tribal air agencies on wildfire smoke impacts and responding to those impacts in regulatory ways and in public health messaging and communications interagency. But I think this is not going to change. I think these headlines are going to stay the same into the future, or maybe there will be more of them, but likely not less. Okay, so this is an EPA chart, actually, or generated from EPA data. I put this up here to illustrate that, this is ground-based monitoring in the U.S., and it looks to me like in the East, you go a block or two, and you get to a ground-based monitor. But look at the West. You have enormous gaps in data, and that's where HAQAST and satellite data becomes so important, because you have no idea what's going on in those gaps. And in those gaps, I want to point out, too, that there's a lot of terrain, because the West is very mountainous, and that terrain becomes very important for pollutant dispersion. I know I'm close on time, trying to go more quickly with this. So satellite data in the West. So the West, we're very focused on, as I said, wildfire smoke analysis, forecasting, exceptional event demonstrations. I can't say enough about that right now, and I know some of you are probably puzzled. What is an exceptional event? But that has a lot to do with wildfire smoke and proving where we have exceedances of the National Ambient Air Quality Standards. Emissions inventory development, emissions inventories in the West are going to be very important going forward. And then for air quality decision making, of course, too. There are many, many more ways we can use satellite data, and some of them are here. But go on and get to my final slide. There's my my contact information. It's a picture from my house in Santa Fe, New Mexico, just as a large wildfire broke out in the mountains. That actually didn't really affect the air quality in Santa Fe for many reasons, but it's an interesting picture anyway. So that is all I have, and I think we're ready for the next speaker.
Thank you both. Learned a lot about the West. And our last pair in what has been a really exciting lineup is Jennifer Kaiser from Georgia Tech and Byeong-Uk from the Georgia Department of Environmental Protection. And Jen works with Ted Russell, who is one of our HAQAST members who is out of town right now.
He wishes he could be here. He's teaching in New Zealand. So if I could actually, Ted is one of those original HAQAST OGs, and so I'm told, and we kind of gave everyone guru names, I'd say. He's one of the guru, give him two things he's a guru of, and one is cohort building. So some of the students and colleagues you'll see here and on the next slide as well, he's built an amazing team, and it's been a pleasure to work with some of them. And then the other thing, and you'll hear more about this, is most of the projects that the team has worked on is expanding the impact of satellite-based analysis using advanced air quality modeling tools. That's the wrong way. Here are some of those other organizations we've had the pleasure of partnering with. And as you've heard throughout the talks, there are several types of projects that are enabled by HAQAST. Each team has their base project. Each team may participate in multiple of these tiger teams where we're working across different groups, and then rapid response projects as well that are, when a need arises, rapidly addressing a stakeholder needs. I don't have time to talk about all of these, but I thought I'd highlight the base project at Georgia Tech, or the team from TED, as well as more briefly some of the Tiger team and rapid response projects. So the base project is focused on port-related emissions. The reason for this is because air quality near ports maybe hasn't seen the drastic improvement that we've seen in other regions in urban areas, leaving ports as a long-standing hot topic for air quality management. There we go. So the objective of this base project is to assess how emissions from ports have impacted air quality and health. And we focus on two cities, Atlanta, where our port is mostly an airport, the world's busiest airport, and then LA, which has both a seaport and then warehouses and airports as well. As mentioned, the methods here, throughout the HAQAST projects, the team has worked a lot with WRF-CMAQ integrated source apportionment method, which allows us to say not just here's what the air quality is, but here's what's the impact of this source on the area's air quality. If you look at a map of NO2 vertical column densities from Chompomi over Atlanta, that big hot spot is the airport. So what Chompomi allowed us to do was to figure out how in our model we can best represent emissions to better match that map. After we had a good understanding of what the emissions should look like in the model, we're able to play with that model a little bit and turn those emissions up and down and say how much of the ozone we see in Atlanta is a result of that very busy, very useful airport. And we're able to apportion the ozone appropriately. I should say that there are no ground-based measurements near the airport, so this sort of satellite-based assessment is essential. Another example of how we use satellite-based observations and models to understand ports can be seen from this analysis over LA. If you remember back in 2021, there was this crazy supply chain issue. A lot of your Amazon shipments might have been delayed. But what was happening in LA was that the boats were waiting to dock, and a lot of emissions were building up and causing air quality concerns over the region. And we could see, if you compared one year to another, that the vertical column density of NO2 over LA had increased in some regions. So the question was, compared to a prior year, how much of this increase is kind of the fault of the ships? Because when you see a higher number, that might not just be a change in emissions, but it could be reflecting a change in things like meteorology as well. What a model allows us to do is then apportion that change that we see in the column to the relative amount of change that we would have expected if it was just meteorology that was different from year to year, versus the change if we then also include the increased amount of boats at port. So in this sort of way, we're able to use the satellite-based information, but then understand it in a little bit finer detail. So that was the base project. Using that same method, we've done some Tiger team and rapid response projects as well, so always using that WRF-CMAQ integrated source apportionment method. Here we're looking at oil and gas development and its impact on ozone. So ozone isn't necessarily something you can measure from a satellite-based observation in the same way that you can measure NO2. So again, once we have a better understanding of emissions, we can understand the secondary impacts using the model. Here we see the regional impact of oil and natural gas development on MDA8 ozone, and on the right on formaldehyde. And then we've heard a little bit more from prior talks about the New Mexico wildfires, and this method can be ported quite easily to address rapidly emerging problems. So we can look at here the impact of those fires on average PM 2.5 and again on ozone. Something I found interesting here is that this particular event, 22 premature deaths were associated with short-term air quality exposures. That's more than the deaths that were attributable to the flames themselves, and the impact was felt for 10 states radius away. So being able to quantify that impact is useful. But perhaps our most useful outcome for HAQAST is not any one of these individual projects, but as we've heard, it's the people. And our best outcome have been our students and our postdocs. Here, our objective is to develop the next generation of air quality and health researchers that can combine these Earth observations and models to address issues confronting the U.S. and other regions abroad as well. So we involve students. Some are funded by HAQAST. Not all of them are. They're sitting in the same office and they're learning the same tools side by side because they talk to each other. We teach classes on remote sensing, and we bring in our HAQAST projects and they help out. That's always nice to double dip. And those students go on to do amazing things in academia so they can continue this sort of work, but also as part of those stakeholder organizations. Some former students are in the room. Asher, Luke is here somewhere. And some are working with our stakeholder agencies, such as Georgia EPD, who will now take the stage.
All right, good afternoon, everyone. I know that I'm the last one. It's been really an honor to be the last speaker, and so I try not to be stand between now and our more fun event social. All right, clicker doesn't help me out. It's a backward. All right. So again, my name is Byeong-Uk. I'm working for Georgia Environmental Protection Division. Well, I would like to share what we've been enjoying with the HAQAST. I guess I should confess one thing here, that I was living in a dark side before I met with the HAQAST guys, and HAQAST helped me to move to the brighter, more fun side in terms of satellite. The reason that I'm saying is when OMI data has been used for our daily work as a modeler, maybe it's just me or just as usual, I was a little skeptical about the satellite data for real use, and then I gradually learned that also with other experts that it's been very helpful to analyzing and what it means by, what the model output that I'm looking at, and gradually I become more sort of evangelist, I guess, for the satellite data, especially the activity that HAQAST folks doing. So that also convince our upper management so that we are actively using satellite data for our daily process. A couple of examples that I can share is that excellence report that we're doing. Whenever we have a measured pollutants that's over the next level, then we have to come up with a short report within 2 to 3 business days. So you can imagine how busy we are, especially some seasons like ozone season and fire season. And also recently we've been working on an exceptional event demonstration, which is a legal process that we will define our design value based upon it. So it's a pretty big deal for us. And then it's a little side work, but our ambient monitoring program also need to justify where the monitors will be based on certain data. And obviously, one of the questions is, where should we put the data, the monitor, sorry. Then the satellite obviously very helpful to make our decision. So this is a quick example that we've been doing ourselves, that the exceedance days versus non-exceedance days, as Jen already mentioned, that we have seen high NO2 value over the Atlanta airport whenever we have a high ozone concentration. And I wanted to double check whether we see the same thing with the troponin and tempo, and obviously it does. This is based on the beta data, so that we'll do another data with the provisional another analysis with the provisional data, but I believe the trend will be the same. And we want to do more analysis later with the Pandora and the ground-based monitoring. Eventually, I want to connect the dots from the VCD down to the ground level measurement so that we can have a more, broad aspect of the data that we can use for other work. And also, as part of the extensive report, we've been adding these plots. Right now, I'm showing the tropomy, but we are adding tempo hourly data so that we can see the evolution of the NO2 column data. And this is typical data. You can see that where the fire happened, the pre-cigarette burn happened, that likely hit the monitor later. And hopefully this, anyway, okay, good. This has been really helpful. I really appreciate the slider team at the NOAA, because now you can see that where the fire happened and directly hit the monitor, and then you can actually associate the hourly evolution of PM2.5. This is clear cut, and we love to have these cases a lot going forward. I mean, not that I'm saying that I want to have a high PM2.5 concentration, but if we have those, we want to explain why it happened clearly. And this is the plot that we've been included in our exceptional event demonstration. We called it this as an integrated plot. We just dump all the information in one nice plot as much as possible, and then explaining why we think that certain days that we have to exceed the next level. And this is what we use for the monitoring assessment report or the documents out of the OMI data. And I want to emphasize that Giovanni, for this purpose, was extremely helpful because I could make this plot in like 20 minutes or 15. So, and there's a lot of things I wouldn't necessarily read it over because I don't want to be the guy. But one thing that I want to emphasize at the bottom is that one of the really helpful also thing that I got from HAQAST is the travel fund, because on and off, and you can imagine that state agency, it's sometimes hard to send people to the place where you want to be, and this has been really helpful for me and other modelers to meet with other experts and exchange ideas, and sometimes we share the information that we have that does not necessarily readily available in academia. So I think that's been really good. I guess I hope that next round of the HAQAST team also can carry on. And again, like Jim mentioned, and we stole 2 folks from Georgia Tech in our local. So that I want to emphasize that, at the end of the day, it's people that carry over all the tasks. And so I'm really grateful that I had a chance to work with all of you and also get, good discussion, have a discussion with the local, the universities in our local area, like, the professors in Georgia Tech and Emory, So I hope that this kind of interactive collaboration going on, going forward. And although I'm the last speaker, but I hope that I'm not the last speaker for the program. I hope that it keeps going on and we kind of make a good development going forward. Thank you.
Have a Q&A for a few minutes. All right. Well, thank you all for excellent talks. Any questions from the audience? Oh, great.
Hello. Thank you, everyone, for a great talk. I have kind of like a threefold question. One, there's a lot of discussion about using the satellite data. So from a community-based organization standpoint, like how do we, I know it's going to be publicly available, but how do we, if we want to write it up, how do we get IRB or is it exempt? So that's one part of the question. Number 2, from Miami-Dade, you mentioned a lot of social determinants of health, social drivers, but one of the populations I was concerned that I did not see maternal health or birthing people, and basically what is the impact on premature births, if there was some information around that. And the last part, you're probably like, am I going to remember all this? But the last part, I see a lot of organizations, especially in healthcare, Celia McIntosh, nurse practitioner out of Rochester, New York. I see a lot of organizations data things to death, and then I'm not sure what the action is or the implementation. Like a lot of the data you're collecting, does that go back to some organizations that's able to implement some strategies to help some of these issues? So those are my questions. Thank you.
Who wants to?
So if I understand correctly, your first question is that there's a lot of satellite data out there. How, as a community, you start using it? Where to start?
How can we publish it? Like if I want to write up an article about it, how can I access it? Do I have to get IRB? Is it exempt? Like how do I go through that process?
Yeah. So as throughout this today, you have probably heard, NASA has developed a lot of tools, training materials, tutorials, including if you go on a HAQAST website, there are several tutorials which actually tells you how to get started on using the NASA data. Yes, satellite data can be complex in the beginning, but once you start using, that is why the HAQAST is actually focusing a lot on adding the value and providing the parameter which community can use directly. So you can actually start there. And at the same time, I would also recommend that you can reach out to any of the HAQAST PIs or COI, anybody who is working at NASA. They will be more than happy to help you, or they will be able to connect you to the right person.
Yeah, and just to dovetail that the HAQAST website has data and tools. We have getting started. We point to a lot of the resources out there. But to your question, do you need to file an IRB? No, all of these data are publicly available and can be used. I mean, if you compare it with health data, you need an IRB for that. But for the satellite NASA data products directly, one of the things that makes them easy to work with is that they do not need any kind of prior approval.
Okay. So great question about pregnant people and their exposure to heat. So in the vulnerability analysis that Chris did, he was using census data, available census data for different groups. So we didn't have that for pregnant people, but we know from evidence-based research of the vulnerability of pregnant people, and it is in the same neighborhoods where we have high heat incidences, high asthma, heart, that we have higher preterm births as well. And so we did, as part of our heat season campaign, do specific targeted messaging for pregnant people. And the great thing with social media marketing and digital marketing is that they know who's pregnant. And so actually we had the most engagement, the most clicks with pregnant people in that messaging. We also did, in partnership with the Women's Fund, some billboard ads and did some digital placements in OBGYN offices. So we know that that's one of the vulnerable places. We didn't have that data for that particular study, but it's a really important question because that can change the trajectory of that child's life. So.
How do you avoid just doing like data to death? And with the data that you collect, does any of that information go back to organizations that are able to implement some of these strategies? That's my question.
Happy to talk about kind of from the State Department side. I know you're focused more on domestically, but for us, the really important thing is connecting it to the EPA health guidance. That is very specific in terms of if it's at certain levels, the air quality index kind of translates those numbers that may not seem to make any sense from a data perspective if you're just a novice using this. And making sure that people get that associated health messaging, because it tells them if you are a sensitive group, i.e. you have pre-existing conditions, lung, heart disease, you're pregnant, et cetera, you're a child, these are the things that you should either be doing or avoiding. And so that's where, like, you really, when you're translating the data, it has to be very specific. And I think the EPA's health messaging is great in terms of being very, advising very specifically, here are things you should and should not do from just an activities perspective.
Great. Thank you for great questions. We're a little bit over time, but but I want to make sure that this important panel gets their discussion. If there's any more questions from the audience.
I have a question from online, from Dan Williams. Is there a way to use these satellite data sources to determine the composition of PM 2.5 from wildfires? I assume that would, depending on the fuel source, you'd have a different risk with different expected health outcomes?
My knowledge is that it's very hard to get the composition right now. Maybe with Maya, maybe there might be some better understanding, but it's still quite a challenge to understand composition from satellite because your intermixture, extramixture, you have different optical properties, make it extremely hard right now. That's my understanding.
That's a great question. Any closing? Yeah, oh, great.
This question is for Stephanie. You had mentioned that the Zephyr was developed for management purposes for employees to know the air quality around where they are and at the different missions all around the world. Are there any efforts in place to work with local health departments there, as well as the even schools?
Yeah, absolutely. Great question. So I work on the management side of the house, but we have a very close working relationship with our policy side of the house. So if you haven't heard, the Bureau of Oceans and International Environmental and Scientific Affairs. And so they work with our foreign service officers overseas. Many of them they're called ESTH, or Environment, Science, Technology, and Health Officers, that very often work with universities, other civil societies, local host governments to share this data, share this knowledge, share access to, and inform them of the availability of satellite information, and try to kind of cross that bridge between, like so we created this for the management side of the house, but because it's public, we're able to use it in so many other fashions. So yeah, there's a whole subset of folks that are working in the embassy and consulate space that have these great connections across the board and are using it to engage with them as well.
I know the State Department has the Air Quality Fellows program too, and many of the Air Quality Fellows are also using this kind of satellite data. So, all right, well, I think, unless Jenny, are there any other online questions? No more. So with that, I'd like to thank our panel very much. And I'd like to thank NASA headquarters for hosting us. I'd like to thank, to NASA, and to Jenny and Kara and Summer and Olivia and the meeting team. And really, I would say to all of you, because this is the community that has made it possible with the great problems and the partnerships and advanced research and data and tools. And I'm really looking forward to hearing what happens with the next iteration of HAQAST, and hope to connect with all of you again in the future. So thank you all.